Hello everyone. I hope you can see my screen. I think 1 second lag. Hi, I'm Manisha. I have done my master's in neurology and I work as a project associate at Prakara. So, today's topic is demystifying muscle anatomy. So, why did I choose only this topic, that is muscle anatomy? Before starting the topic, I just want you guys to comment from which stream you are. I mean, in which year you are in, whether you are in first year, second year, third year, or fourth year, or are you a practicing clinician, such that I will understand in like what will be the depth of the topic. How should I teach you? So I'm giving you quick 1 minute. Please comment in which year you are in. Please comment down in which year you are in or in which semester you are in, because I want to know exactly how should I teach you. Should I tell you in depth, or surface anatomy would be fine for you guys. So here we are getting comments. So guys, what happened was, when I was in my bachelor's, I couldn't understand how to read this anatomy. Because see, you might be referring BD Chaurasya or Gray's Anatomy, in which there are beautiful tables drawn where you can see the origin and insertion written there. But how to apply on the human body, that is the most difficult part of a muscle anatomy, which we have studied in BD Chaurasya and whatever textbook which you might have referred. So when I was in my bachelor's, I have just, I mugged up everything. I used to, remember flexor pollicis longus. It takes its origin from XYZ structure and it gets inserted into XYZ structure. What happens if you study like that? If you study like that, it will vanish very soon, maybe within a week or two. But if you want to understand, or if you want to remember the function of that particular muscle, you should exactly know where it is located. That is the particular origin of that muscle and where it is getting exactly inserted. Once you know the location of the muscle, you will be easily able to identify or tell the location, tell the function if someone asks you. If I ask you, what is the action of upper trapezius? What will be your answer? You will be confused. Okay, upper trapezius. We have studied that a trapezius is a diamond-shaped structure. So what is this upper trapezius, middle trapezius, lower trapezius? It has only one action, that is extension of neck or shrugging. No, it has multiple actions because your trapezius is again divided into 3 parts, right? So that all we will learn in depth, because if you know the exact location of the muscle, when the muscle contracts, you will be able to tell its function. Okay. So as I can see in the comments, there are more of third year students and fourth year students and somewhat second year and first year students. So I was expecting more of first year students. So starting with the first slide, what attendees can anticipate from this webinar? That is what you guys are going to get from this webinar. Obviously, understanding muscle structure and its function, we are going to locate the muscle on a human model, and by tracing its origin and insertion, we are going to tell you its function. Applying biomechanics for easy understanding, like how you have studied planes and axes and how you applied it for biomechanics for each, like biomechanics of each complex, like that we are going to apply the same formula for the muscles too. How we will I will explain you it in further slides. Then every participant who is staying till the end of this webinar is going to get certificate of participation. Hence, I want you guys to comment down your email IDs such that we can send you the certificate of participation. Special announcement at the end of the webinar for the attendees who were till the last of the webinar or end of the webinar. Next, bounty for the quiz champion. So this is a bonus for you all. Okay, I have set 10 questions in between each slides. I want you to answer each question, and the student who is answering all the questions correctly and accurately will get a special prize that we will announce in the last. So stay connected till the end. So shall we start? So we are going to study about the muscles of scapula. So in this, okay, let me tell you one thing. In this session, we are going to study only about the muscles of scapula, upper limb muscles. Those are muscles of your arm, shoulder, and your forearm, hands. So in muscles of scapula, we are going to study about the pectorals, serratus anterior, trapezius, levator, scapular, rhomboids. These are very scary muscles. I know the origin and insertion, its action is very, very scary. I know. I used to mug up everything. Muscles of shoulder and arm, your rotator cuff muscles. What are the four muscles of rotator cuff muscles? Supraspinatus, infraspinatus, teres minor, and subscapularis. Those muscles I am going to teach you. Deltoid, biceps, brachialis, brachioradialis, triceps brachii. Muscles of forearm and hand, flexor compartment muscles, extensor compartment muscles, thenar muscles, hypothenar muscles, the lumbricals, and the interossei muscle. I know lumbricals and interossei are very confusing, so I will try to teach you it in an easy way. So, starting with the biomechanics, we have studied in our biomechanics first chapter from Cynthia Hawkins. There are planes and different planes and axes. So there are 3 planes and 3 axes. First plane is the sagittal plane. So sagittal plane cuts the body into 2 halves, that is right half and left half. So it goes like this. So it is dividing the body into right half and left half. Okay. Next is your coronal plane, which is dividing the body into anterior and posterior part. Next is the transverse plane, which is dividing the body into upper and lower halves. Okay, so this thing we are going to apply for the muscles also. Wondering how? I will show you. Okay. So these are the major landmarks, surface anatomy, which you have to understand in order to understand the origin and insertion of the muscles, which I am going to teach you. So here, the most projected part on your back below your neck is your C7 spinous process. Spinous process is nothing but the bony projection of the vertebra. So this is the vertebra. This is the anterior part of the vertebra. This is the posterior part of the vertebra. These are the transverse process of the vertebra. So this is the spinous process. The spinous process in the cervical region is horizontal. Okay, it is straight. Like this. So what is the difference between these 2 spinous processes? If you carefully see them, okay, this is straight and these are projecting downwards. So these are thoracic spinous process. So you have to palpate this spinous process for finding out the C7 spinous process, which I will show you. And between C7 and T3, there is your medial, there is your spine of scapula. So this part which you are seeing here, this part, this is the spine of scapula. The spine of scapula is located at T3 region. These inferior angle of scapula are located at T7 spinous process. It is located at T7 spinous process. Okay, so these are the major bony landmarks which you have to understand in order to understand the exact location of the muscles which I am going to teach you. Okay. So let me show it on model here. So in this present webinar, I am the female Arjun Reddy and he is my Preeti because I have drawn beautifully on his body. Okay, if you can clearly see it. If you have any doubts, you can comment in the comment section. Okay, so here, this is the bony projection here, which is most prominent. This is T7 spinous process. Okay, and with 1 inch difference, you have T1, T2, and T3. So this T3, it has, when you traverse the path here, it has the spinal scapula, okay, because it also has the insertions, which we will talk about. Next, going down, you can palpate the inferior angle of scapula first. So first, you can clearly see the margin, right? So this is the inferior angle of the scapula. So if you join these, you will get the T7 spinous process. Okay. So after marking all this, you need not mark it on the patient. With practice, with palpation, you will understand, you will know that what are the exact bony landmarks. For that, you have to palpate the patient's back continuously. Okay. So I will use him again for the, you can please. Okay. So hope this is interesting. So there is first question popping here on my screen. I want you to answer as quickly as possible because we are noting down the names of the participants who are giving us the correct answer. Okay, so stay connected. So here is your first question. Kaun banega crorepati? Bilateral contraction of the sternocleidomastoid causes what action? Read the question carefully. You have only 20 seconds. Bilateral contraction of sternocleidomastoid causes what action? Option A, extension of head. Option B, flexion of head or neck. Rotation of the head, ipsilateral flexion of the head. Read my question carefully. Bilateral contraction of sternocleidomastoid causes what action? Your clock is ticking. Faster. Yeah, we are getting comments. Very nice. More 10 seconds. Bilateral contraction of... Guys, read the question properly. Bilateral contraction of sternocleidomastoid causes what? Bilateral contraction. Bilateral is nothing but contraction on both the sides. Okay. So your answer has been... Moving on to the next slide. So answers will be revealed in class. Okay, answer you'll get here only because the next slide is about, which is sternocleidoid. The origin, so the sternocleidomastoid, which we have in our textbooks, origin was from manubrium sterni and clavicle, insertion temporal bone, occipital bone, blah, 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 which we have studied in our textbooks. So how do you apply it on a human body? See, I have this skull. Okay, the skull has external occipital protuberance and the nuchal line. Okay, so this is the insertion part of the sternocleidomastoid. Where the origin? Origin is from the clavicle. So this is the left side of the clavicle. And if you want me to even explain the side determination, we will take another webinar for that. Side determination of all the bones made easy. Okay. So this is the left side clavicle. Okay. This is the left side clavicle. And now, how do you trace the path of the sternocleidomastoid? So now, this is the skull. Okay. This is the left side of the clavicle, this side. As I told you, it takes the origin from manubrium, as the name implies, sternocleidomastoid. It has the origin from the sternum. So we have sternum here. This is the sternum. Okay. This is the manubrium of the sternum. So it has the origin from the manubrium, that is from here, that is your sternum, and also from the clavicle, medial third of the clavicle here. And it gets inserted on the, okay, let me show you a side view. Okay. It gets inserted into the posterior aspect of the skull, that is your backside of the skull, where temporal bone and occipital bone, that is nothing but your superior nuchal line and external occipital protuberance. So just imagine when this is contracting, it will cause ipsilateral flexion and contralateral rotation. Okay. So let me explain you on my body. So this line which you're seeing here, this one, this is your sternocleidomastoid, which is on the medial end of the clavicle. Okay. So it is traveling straight up like this and it is going behind your skull. So I have in the first slide, I have shown you the biomechanics axis and planes, right? So it is crossing the midline, that it is going back. If the muscle is present in front, then it will lead to flexion. If the muscle is going back, or if the muscle is present back, it will cause extension. Okay. So this part, the front part, will cause the flexion. And as it is traversing back, when it contracts, it will cause ipsilateral flexion and contralateral rotation. So you guys do it on yourself, you will understand it more clearly. So it has the origin from the sternum clavicle, and it will go insert on the backside. Then when it contracts, see, how does a muscle contract? When it contracts, it shortens, right? So the muscle shortens when it contracts. So when this is contracting, it is shortening and it is helping you do this movement. So that is the function of sternocleidomastoid. If there is bilateral contraction, that is, if both sides sternocleidomastoid are contracting, it will lead to flexion of your neck. Okay, if only one side of sternocleidomastoid is contracting, it will lead to ipsilateral flexion and contralateral rotation. Why contralateral rotation? Because it has gone backside, right? It has gone, it got inserted into the temporal bone and occipital bone. That's the reason why we can see contralateral rotation. Hope you understood. Hope you understood sternocleidomastoid. So I think you might have got answer for the first question. So those who gave wrong answer, you lost your chance to win. I mean, your chances for winning are reduced. Now, next slide. Pectoralis major. Pectoralis major, isn't it very scary? See the image there. It is a long fan-shaped muscle, right? So how do I explain pectoralis major? It has three parts: clavicular part, sternocostal part, abdominal part, right? So let me show it on the model. Okay. So as you can see here, this is the manubrium, this is the sternum. Okay. So we have seen the origin of pectoralis major. It has the origin from the clavicular part, that is the medial end of the clavicle. Okay. And the sternal part, it also takes its origin from the abdominal part. So from the abdomen, that is the fascia of rectus sheath. So from the rectus sheath, it also takes its origin. So the muscle fans out like this. Okay. So the muscle will be like this. This is how the muscle is. And it gets inserted into the lateral lip of the tubercular sulcus. So humerus has the, so this is the humerus. Humerus has the humerus has the intertubercular sulcus. So in the intertubercular sulcus, there is the medial lip and the lateral lip. In the lateral lip, you have the pectoralis major insertion. Okay, on the medial lip, you have another major, that is your teres major. So this is the left side humerus. It has pectoralis major on the left lip. So what happens if it is getting inserted on the lateral lip of the intertubercular sulcus? When it is getting contracted, that is, if you can see here properly, this pectoralis major has fanned out like this, right? So when this is getting contracted, the humerus is rotating internally, if you can properly see, okay? Because it has insertion on the lateral lip. So it will cause medial rotation as well as adduction like this, okay? Because the origin and insertion of the pectoralis major is built in such way that it will cause internal rotation and adduction, okay? And one more point about pectoralis major is it has two laminas. First is the anterior lamina. This anterior lamina is formed by the clavicular part, I have told you, it has clavicular origin also. Okay. So clavicular origin, sternal origin, and abdominal origin. Clavicular part, these fibers and some fibers of the sternum will go and get inserted onto the same part, that is the lateral lip, but anteriorly. These fibers will go and get attached on the lateral lip posteriorly. So this will become your anterior lamina and this will become your posterior lamina. Okay. So these both, when contract, they cause internal rotation and adduction. Hope you understood. So this is the origin and insertion of pectoralis major. What is the next muscle? See, next muscle is serratus anterior. I cannot show you this on his body. I will show you on the scapula. Okay. So, serratus anterior. Serratus anterior, as you can see on the screen, it is originating from where? It is originating from the ribs. So, this is the sternum. Okay. This is the sternum. These are the costal cartilages. So we don't have our ribs because it has been dismantled and I couldn't get ribs for you. So just imagine that there are ribs over here and the vertebral column is present behind this. Okay. So let me show it to you in the side view. This is the sternum and we have vertebrae here. Okay. So just imagine vertebrae are present over here and these two are connected by what? By ribs. Okay. Now, this is the serratus anterior, which is a fan-shaped structure. This is a fan-shaped structure. It takes its origin from the ribs. Which ribs? First to ninth rib. So start from first and end it on the ninth rib. So from first to ninth rib, these are taking its origin and it is getting inserted at what place? It is getting inserted on the scapula. Where on the scapula? On the medial border of the scapula. See, medial border. Here it is getting inserted. So which side scapula this is? This is a left-sided scapula. How am I able to tell you that this is a left side scapula? Because see, the glenoid cavity should be projected towards the left, towards the outer side. You cannot put it like this. Okay. Okay, for this side, for the right side also, this is applicable, that the glenoid cavity is over the outer portion. Okay. Okay. So, glenoid cavity is on the outer side. But what about the spine of scapula? The spine of scapula should be on the posterior aspect. So here, considering all these points, glenoid cavity is on the outer side, that is on the left side, and the spine of scapula is also on the posterior side. Now, here on this border, not on the surface. So border is different from the surface. This is the surface. This is the anterior surface. Okay. It is attached on the border. So like this, it is getting attached. Okay. Just like this. Like this. Okay. And this is taking its origin from the ribs. So what happens when this muscle is contracting? When the muscle is contracting like this, that is when the muscle is getting shortened like this, when the muscle is getting shortened like this, it will pull the scapula anteriorly and laterally. Okay, so this is the scapula. Okay, when this muscle is pulling it, it is pulling in anteriorly and lateral direction because it is attached to the medial border like this. The direction is like this. It is curved, right? So it will pull it anteriorly and laterally. So the action of serratus anterior is anterolateral. It draws the scapula anterolaterally. So this movement is caused by serratus anterior. Hope you understood. Now, coming to the next slide. See, your serratus anterior draws the scapula anterolaterally and inferiorlaterally. Now, quiz time. The second question is, pectoralis major does not take its origin from. So read the question properly. Pectoralis major does not take its origin from? Option A, clavicle. Option B, scapula. Option C, abdomen. Option D, humerus. I think we have posted this in the group also, and we've got a lot of wrong answers. So as I have already explained you, where does this pectoralis major exactly starts from? You should be able to tell. It's the answer for this question. So I can see more of C's, D's. Scapula. Oh my God, scapula. Okay. Okay. Origin or insertion also. I mean, the question should be its origin and insertion. That is where it is not attached exactly. So it also has attachment to the scapula. It also has the attachment towards abdomen, also clavicle. So the correct answer, I'll tell you in the last. Okay? Keep commenting, guys. It's okay to give wrong answers. Now, the bomb muscle, that is your trapezius. See, in gym, did you ever notice guys who, flaunt their trapezius, the muscle which is present over here, a bump of muscle is present over here, right? That is nothing but your trapezius. So they train a lot to, flaunt their trapezius. My brother, he keeps asking me the workouts for upper trapezius. He comes to me and he tells, Didi, please tell me the workout to increase this muscle size, that is your upper trapezius. So, generation nowadays has become like this. They search everything on the internet. But we physios should know where exactly is the muscle and what function does that muscle has. Only then you will be able to tell the exact exercise for that particular muscle. That's the reason why we have decided to take a class on muscle anatomy. So trapezius, see the first section which you can see here, this is of upper trapezius. This is of the second one is of the middle trapezius, and the last one is of the lower trapezius. So let me explain this on my Preeti. Okay? Come, Preeti. So remember, I am Arjun Reddy here because I drew all this on his body. So, I hope you all can see. Okay, now I think it is more visible. Okay, so trapezius is a diamond-shaped structure. So anyone who is writing about the trapezius in your answer, you first point you write beautifully is that trapezius is a diamond-shaped structure which is present on your back. Okay, so it takes its origin mostly from this whole vertebral column. Okay, that is from C7 to T12. Okay, it is taking the origin from all these vertebrae. So anatomy, if you read, it is the same. If I read, it is the same. But how do you remember is what is important. Okay, so C7 and ligamentum nuchae, external occipital protuberance. These all have the origin for what? Upper trapezius. So this, your trapezius is divided into three parts. Can you get me a marker? So this is divided into three parts. So this is your upper trapezius. So let me make it a triangular shaped structure. Okay. It has its origin till T12, I said, no? So it is a diamond shaped structure. It is divided into three parts. Upper trapezius, middle trapezius, and the lower trapezius. So this is the upper trapezius, this is the middle trapezius, this is the lower trapezius. So upper trapezius is also known as descending trapezius because the fibers are descending down like this. This middle trapezius is known as transverse trapezius or transverse fibers because they are running horizontally. Lower trapezius is also known as ascending trapezius because the muscles are ascending upwards like this. Okay. So The origin of upper trapezius is from the external occipital protuberance, ligamentum nuchae, and your C7 spinous process. What happens to the cervical vertebrae? Which muscle is taking origin from that? That I will tell you in the next slide. Remember this point, okay? So from C7 and the ligamentum nuchae, it is taking its origin and it is getting inserted into the lateral 1/3 of the clavicle. So clavicle is present towards the anterior side. Can you please punch a moment here? Okay? Towards the lateral aspect of the clavicle. So your upper trapezius, done. Middle trapezius, it has origin from T1 to T4. The last part of the trapezius, lower trapezius, has its origin from T4 to T12. So how do you remember this T1, T2, T3, T11, T12? C7 is only one vertebrae, right? Then next four vertebrae are for middle trapezius. Double of 4 is what? 8. So next eight vertebrae has the origin for lower trapezius. Okay, so you can remember it this way. So now as you have located the muscle, you tell me where is the insertion for T1 to T4 muscle? That is your middle trapezius. You guys can comment. It's okay. I have the accessibility to see the comments. Okay. So the insertion for the middle trapezius is the spine of the scapula. Spine of the scapula is nothing but this region. This region. So here, if I put two scapulas, if I put the two scapulas like this, okay. If I put the scapulas like this, it is present like this. It is present like this. So when the middle trapezius is contracting, what is it doing? It is drawing both the scapula medially. It is drawing both the scapula medially. So this is the action of what? Middle fibers of trapezius. Okay. And like this. Okay. It is drawing both the scapula like this. Good. Like this. Okay. And what is the action of the muscle? The lower fibers. So these lower fibers, as I told you, that they go and get inserted at the scapula, medial end of the medial border of the scapula on the posterior aspect. When they contract, it will pull the scapula inferiorly and medially like this. Okay. The scapula is coming inferiorly and it is coming medially because you see the orientation of the muscles. The muscles are like this. So when they contract, they will pull the bone down like this. So this is what movement? This is inferomedial movement. So the lower fibers of trapezius causes inferomedial movement of the scapula inferomedially. Okay. So this was about the trapezius and the upper fibers. When the upper fibers contract, as they do not have any contact with the scapula, I can remove this because it got inserted into the clavicle. So when they contract, it will cause extension. It will cause neck extension. That too bilaterally. If bilaterally they are contracting, it will cause neck extension. If it is contracting unilaterally, it has the same action of what? Sternocleidomastoid. That is, it will do ipsilateral flexion and contralateral rotation. So this is about trapezius. Okay. Hope you guys understood. Done with the trapezius? So this is how your trapezius looks like. Now, levator scapulae, as I told you that till our trapezius started from C7, right? What happens to the upper cervical region? So C1 to C4 will take the origin of the levator scapulae and it gets inserted into the medial border of the scapula. Okay, sir, Randy. Just insert the pictures. So from here, it gets inserted on the medial border. So when it contracts, it elevates the scapula. That is, there is superior-medial. Okay. Now there is superior-medial. That is, muscle is like this. The muscle is like this. Okay, it got inserted into the medial border of the scapula. Okay, when this muscle contracted, it pulled the scapula superiorly and medially. See, if the scapula is moving up, it is superior. If it is moving down, it is inferior. If it is moving medial this way, it is medial. If it is moving that way, that is lateral. Okay. This levator scapulae, what it did, when it contracted, it pulled the scapula upwards and medially. So it has the action of superior medial. Okay. So this is about the levator scapulae. My Preeti is helping me a lot today. Okay. So now coming to next muscle. Levator scapulae. Rhomboid muscle. So this was a nightmare for me because I usually used to forget its origin points because they are almost similar, C7, T1 and all. So see the slide. Rhomboid minor is a minor muscle. It has only origin from the two vertebrae, that is C1 and C7 and T1. Rhomboid major, as it is a bit larger muscle, it has the origin from T to T5. So wherever exactly this scapula is present, that is from C7 to T5, there exactly this rhomboids minor and major takes the origin and it gets inserted into the spine of scapula. So this is the origin, C7 T1. T1 to T5 is the origin of rhomboid major. So it is getting inserted on, see, again, medial border of the scapula. So if you see the muscle like this is the anterior part and this is the posterior part because spine of scapula is on the posterior part. This is the left-sided scapula. So this rhomboid muscle is getting inserted on the medial border. Okay. It is getting inserted on the medial border. So what happens when the rhomboids major or minor is pulling the scapula? So it is taking the origin from here. It is getting inserted on the medial border of the scapula. It is getting inserted on the medial border of the scapula. So when it contracts, when this muscle contracts, it will pull the scapula superior medially like this, like the levator scapula. So, but more strongly because it is a short muscle and it is present, it is closer to the scapula. That's why it will pull the scapula superior medially. This is how you have to learn the muscles. Now, this was about the rhomboids, and rhomboids also helps in stabilization of the scapula. So with whatever muscles which are small and which are closer to the scapula, those muscles will help in stabilization of the scapula. Next, time for the quiz. Question 3. The major action of lower trapezius or ascending trapezius is what? Do not get confused. I have explained you the movements of the scapula. Superior, inferior, superior lateral, inferior medial, these all. Okay. Major action of lower trapezius or ascending trapezius is what? A. Draws scapula superior medially. So what is superior medially? Draws the scapula superior medially, draws the scapula medially, draws the scapula inferior medially, draws the scapula superiorly. Again, draws the scapula superior medially, draws the scapula medially, draws the scapula inferior medially, draws the scapula superiorly. So tell me the correct answer. Lower trapezius is pulling the scapula in which direction? Okay. I can see more of C's. I think you guys lovely. I can see many C's in the comment section. Superiorly, superior medially, medially, inferiorly. Inferiormedially. Okay. So we have got enough answers. Nice to see you guys are commenting. You guys are giving correct answers actually. Okay. Now, next, rotator cuff muscles. These muscles are the bread and butter for the physiotherapist. You have to understand where exactly is supraspinatus, infraspinatus, because supraspinatus muscle is the major muscle where you will see patients coming to you with supraspinatus tendinitis. There are many special tests also to rule out whether it is supraspinatus, infraspinatus, teres minor, major. Okay. So, supraspinatus, this is the scapula. Which side scapula it is? Now, you guys tell me which side scapula it is. I'm giving you 10 seconds to identify which side scapula it is. Start. Tell me which side scapula it is. Which side scapula it is? Please comment. It's okay. If you give the wrong answer also, that is totally fine. But try to understand which side of scapula it is. See, glenoid cavity is on the lateral side. Spine of scapula should be on the posterior side. Come on, give right, left, right, left, right, left. Is there any other side? Right or left, right or left, right or left. Okay, this is a left side scapula. Lovely. I can see many lefts. So I hope you understood how to recognize the scapula. So we have covered side determination here also. So this is a left side scapula. Okay. Here is the supraspinous fossa. This is the infraspinous fossa. This is divided by the spine of scapula into two parts. So supraspinous fossa, see, just imagine, supraspinous fossa is so small, it lodges a muscle which is smaller than infraspinatus. Okay. It lodges a muscle which is smaller than the infraspinatus, but you can see more of supraspinatus tendinitis. Okay, how we will study that in further sessions. If you guys are interested, we can take a session on that also. So this supraspinatus muscle, which is taking the origin from the supraspinous fossa. Okay, so it is taking the origin like this. So this is the spine of the scapula. Okay, it is taking the origin like this from the supraspinous fossa, and it is getting inserted on the greater tubercle of humerus. Okay, so from here it is going and getting inserted here on the greater tubercle of humerus. So this is the humerus. Humerus has the lesser tubercle and the greater tubercle. Yeah, lesser tubercle and the greater tubercle. Greater tubercle is on the lateral aspect. This is the intertubercular sulcus. Okay, it has the medial lip and lateral lip. What is, okay, question. What is attached to the lateral lip of the intertubercular sulcus? Come on, start. Bicipital groove, intertubercular sulcus or bicipital groove. Comment down fast. What is attached to the lateral lip of the intertubercular sulcus or groove? Fast. Guys, please subscribe our app for more such content. Start. I want the comments. Yeah, I can see. So on the lateral lip, yes, you guys are correct. Pectoralis major, as we have already studied, pectoralis major is getting inserted on the lateral lip of the humerus. So this supraspinatus, it gets inserted, it comes like this. Okay, it comes like this and it gets inserted on the greater tubercle. Okay, greater tubercle like this from superiorly. Like this, it comes and it gets inserted onto the greater tubercle. So when this supraspinatus contracts, that is when it gets shortened, you will see shoulder abduction. You will see the shoulder abduction because it has crossed the superior aspect of the humerus and it got inserted on the greater tubercle. So when this is getting contracted, you can see the shoulder abduction. This is the action of supraspinatus. Okay. So supraspinous fossa, greater tubercle of humerus, it initiates the abduction of arm at 15 degrees. That is from 0 to 15 degrees, your supraspinatus plays a major role. So what happens after 15 degrees of abduction? Which muscle takes the action of abduction after 15 degrees? So till 15 degrees, your supraspinatus was there. Well and good. After 15 degrees, who is taking care? Comes your major mogambo muscle, that is your deltoid. So you guys might have seen boys flaunting their deltoid biceps. There's a bump over here. That is nothing but your deltoid. So the middle deltoid, we will study about the deltoid also. So the middle deltoid takes over the action of abduction after 15 degrees. Guys, make a note of this because this is a very, very, very important question, that which muscle takes the abduction after 15 degrees. So 15 to 90 degrees, this is 90 degrees. So 15 to 90 degrees, your deltoid will take over the action. After 90 degrees, which muscle is taking? Because deltoid contracted and it got shortened already. So beyond that, it cannot pull your humerus. So which muscle will pull your humerus? Which muscle will pull your shoulder joint into abduction? That muscle is nothing but trapezius, because we have seen, right? Trapezius has the insertion over the upper trapezius has the insertion over the lateral clavicle. Also, middle and lower fibers will pull the scapula like this. It will pull the scapula like this. If the scapula is being pulled like this, okay, if the scapula is being pulled like this, what happens to the humerus? What happens to the humerus if the scapula is being pulled like this? This will also cause abduction. So the muscles which are present here, those muscles will also help in abduction, like trapezius, because trapezius was present here, no, like this. So this is the left-sided one. This is the medial border. So trapezius was pulling it like this. Infero-medially, it was pulling it like this. It was pulling it like this. Okay. So it will get the humerus into abduction. So beyond 90 degrees, your scapular muscles are also helping in abduction. Next is beyond 100 degrees, your trapezius as well as serratus anterior. Your trapezius as well as serratus. Serratus anterior, I have told you, it is getting attached to the medial border. So when it is pulling, it will also pull the humerus into abduction. So make a note of all these muscles because these can be asked in your Viva question. Now, coming to the next muscle, which is your infraspinatus. Infraspinatus, obviously, I will not take much time because you all know it starts from the infraspinous fossa and it gets into the, again, same part of the humerus, that is your greater tubercle of humerus, and it will lead to external rotation of arm. Why? Because it was going like this and it got inserted on the from infraspinous fossa, it got inserted into the greater tubercle like this. Okay. So when I am contracting this, I am pulling my humerus into external rotation as well as adduction. It will also cause adduction and it will also cause external rotation. Same is the action of teres minor. I hope you guys are understanding. Please give me a heads up if you guys are understanding because I can't see you. At least through your comments, I will understand you are able to understand it or not. So please, if you are able to understand, give me a heads up, say a yes. If not, you can comment no. I will try to improvise myself. Okay. So infraspinatus will cause external rotation. Next, teres minor. So again, teres minor takes the origin from the lateral border. Medial border, what was there on the medial border? On the medial border, you had the insertion of trapezius. We have seen, no, trapezius gets inserted into the medial borders. On the lateral border, contrary to that, you have the teres minor. So this teres minor also goes along with the infraspinatus. This is the infraspinous fossa, right? Along with the infraspinatus, it goes and it gets inserted into the greater tubercle. And this will also cause what? It will also cause external rotation. It will also cause the external rotation. Because see, if I'm pulling this, it will cause external rotation and adduction, obviously. Adduction and external rotation. Okay? Hope you guys are understanding. Next, subscapularis. Subscapularis, you cannot palpate. Normally on a patient, there's a different technique to palpate subscapularis that I will show you in our next lecture, because this is all about origin and insertion. How to palpate, I will show you again. This takes origin from where? This is what? This is the subscapular fossa. Now tell me, which side is this? I have changed the scapula now. Is it left or right? I told you the answer. It is the right-sided scapula, okay? Because the glenoid cavity is present here, the spine of the scapula is present on the posterior side, okay? So, over here, which muscle was present? Comment, come on. I want the answer. This is the right-sided scapula, and this is the medial border of the scapula. Anteriorly on the medial border of the scapula, which muscle got inserted? We have studied about it. Which muscle got inserted? Which muscle got inserted on the medial border? Pectoralis major is the wrong answer. Pectoralis major has the insertion on what? On the lip, lateral lip. On the medial border. We have studied on the medial border. You remember this structure? What was this? Lovely. It is serratus anterior. So it had the serratus anterior on the medial border. I told you that surface is occupied by something else. So who occupied this surface? Your surface is occupied by subscapularis muscle. So this muscle is present here like this. It nicely sits like this. Upon that, this muscle will be present. It took the origin from the ribs, right? Like this. And it got inserted on the medial border. It is present on the surface of this subscapularis fossa. Okay? Like this. So it gets inserted into the lesser tubercle. Okay? It gets inserted on the lesser tubercle. So it causes what? It causes internal rotation, obviously. So this is the humerus, right? I want to write humerus. So this is the right-sided humerus. This is the lesser tubercle. This is the greater tubercle. Whatever was present on the greater tubercle pulled the humerus into external rotation like this. Okay. Now, whatever is present like this on the lesser tubercle, it will pull the humerus into adduction as well as internal rotation, because this muscle, subscapularis muscle, has taken its origin from the subscapular fossa. It traveled nicely till here on the lesser tubercle, and it pulled the humerus into internal rotation. Okay, so this is about subscapularis. I hope you guys are understanding. I'm glad to see so many comments, and that too correct answers you guys are giving. Okay, now comes the major muscle, that is your deltoid, and this is my favorite muscle, deltoid, believe it or not, because I have studied deltoid in such a way that it is, very easy for me to tell its origin, insertion and all. So deltoid is a cape-like structure which is present over this part. Okay, here. It has three parts. One is clavicular part, one is acromial part, which is present over here, and another one is spine of scapula. So I will show you what all those are. So it has the origin from the clavicle. Okay, it has the origin from the acromion process. It has the origin from the spine of the scapula. So acromion process, clavicle, as well as spine of scapula. So it has three parts, and these three parts will merge like this, and it will get inserted on the deltoid tuberosity of the humerus. So humerus has something known as deltoid tuberosity. So This part which is coming anteriorly is also known as anterior deltoid. The muscle which is coming like this from the acromial process, this is known as middle deltoid. And the muscle which is coming from the posterior aspect is also known as posterior deltoid or rear deltoid. So my brother keeps talking about the deltoid. That's why this is my favorite muscle. Okay, so it is present. It is present like this. It is literally present like this. Okay. How's my Preeti looking, guys? Okay, so this is how the deltoid looks. So how now action of each deltoid. So now if someone asks you what is the action of deltoid, how you should answer, you should tell them that the deltoid has 3 parts. Ma'am, which deltoid's action you want? I want anterior deltoid's action. So anteriorly, see, I have told you that our body is divided into planes and axes. Our body is divided by the planes and axes. So if this is a sagittal plane, for the sagittal plane, the movement should be parallel like this. Okay. So flexion and extension occurs in sagittal plane. So the movement should be parallel to the plane and perpendicular to the axis. So sagittal plane is now parallel to this movement, flexion extension. Okay. Draw a joint line like this. The muscle which is present anterior to the anterior to this joint line is your anterior deltoid. Hence, when this contracts, it will cause flexion. Which muscle? Anterior deltoid will cause flexion. Middle deltoid, it took its origin from acromion process. It got inserted into deltoid process. When it contracts, it will pull the joint into abduction. Okay. Posterior here. Okay. Posterior to this joint line, you have drawn a joint line, anterior, middle, and posterior. Posteriorly, when it is contracting, it is causing shoulder extension. So your deltoid has role in all the movements, that is flexion, abduction, extension. Okay, anterior deltoid, middle deltoid, posterior deltoid. Anterior deltoid from the lateral clavicle, acromial part, middle deltoid, spine of the scapula, posterior deltoid. Okay, hope you understood the function of deltoid. So if someone asks you the action of the deltoid, it not only helps in abduction beyond 15 degrees. 0 to 15 degrees was which muscle? Supraspinatus. 15 to 90 was which muscle? Deltoid, middle deltoid. Above 90 was your trapezius, and also your trapezius helped beyond this, and also your serratus anterior helped beyond 100 degrees. Okay, so this was about the deltoid. Let me have some water. Okay. Now guys, next, this is the image of the deltoid. Question 4. Come on, get ready with your keypad to type the answer. Which among the following is not a shoulder abductor? Is not a shoulder abductor. Not a shoulder abductor. Not a shoulder abductor. Read the question properly. Which among the following is not a shoulder abductor? Middle deltoid, serratus anterior, supraspinatus, and infraspinatus. Your clock is ticking. Start the answers. What is the answer? Oh my goodness, lovely. D. Yes, as I've told you, 0 to 15 degrees is taken up by supraspinatus. Above 15, that is 15 to 19, is by option A, that is your middle deltoid. Above that is your trapezius as well as serratus anterior. So infraspinatus helps other muscles in stabilizing the scapula. Okay, but it is not a shoulder abductor. Okay. Now, another question. Wow. Which muscle is primarily responsible for shoulder abduction beyond 15 degrees? Primarily, which is useful for shoulder abduction beyond 15 degrees? Come on, start your answer. I want a lot of answers. Guys, you have something in the last. Give the correct answers and I have a lovely prize for you all, as well as certificate of participation. Come on. Primarily. Focus on the word primarily. Because above 15 degrees, every muscle will help. Oh my goodness. Lovely, lovely, lovely. Trapezius. Primarily. See, trapezius also helps. I agree. Trapezius as well as serratus anterior also helps in shoulder abduction. But I have used the term primarily. Primarily means which is a major muscle which is causing abduction beyond 15 degrees is your middle deltoid. Oh, I was supposed to reveal the answer at the last. It's okay. Okay, next, biceps brachii. Guys, how many guys are there? How many guys are there? You guys love to flaunt your biceps, right? Because my brother does. My brother does. And my Preeti will also flaunt his biceps. If you want to see his biceps, show your biceps. See, my Preeti's biceps. Lovely biceps, no? Okay. So this biceps, guys, my Preeti has lovely biceps than you all. So biceps brachii takes the origin from okay. Biceps brachii takes the origin from, it has, okay, as the name itself is telling you, biceps, it has two heads. Okay. It has short head and long head. Short head takes the origin from this process. This is coracoid process. Okay. From here, it is crossing the humerus. It is crossing the humerus and it gets inserted way down in the which tuberosity? It gets inserted into the radial tuberosity. Okay. I will show you how. Okay. And the long head takes the origin from the supraglenoid tubercle. See, I don't know how you guys remembered this, but I remembered it in this way because glenoid cavity has two origins. One is for biceps and one is for triceps. Okay. I have studied it this way. 2, 3. From superior to inferior, it is 2. In ascending order. So 2 and 3. So supraglenoid tubercle has the origin for biceps, long head. Infraglenoid tubercle has the in origin for triceps. So I have remembered this way, 2, 3. So 2 here and triceps here. And the short head takes the origin from the coracoid process from here anteriorly because it is a short muscle, short head of biceps. So it gets inserted on the radial tuberosity. That is, if you see it properly, I think it is visible. I'm just trying to show you the lower part of it. It has, this is wrong. I want another one. No. Okay, give. Okay. So this is the left-sided one. It has the radial tuberosity here. On the radius, we have the radial tuberosity. So the bicep starts from there and it gets inserted into the radial tuberosity. So guys, let me tell you one thing. You all know that biceps helps in flexion as it is a two-joint muscle that it is crossing the shoulder joint as well as it is crossing the elbow joint. It helps in shoulder flexion as well as elbow flexion. Apart from that, it also has one more function. That is it causes supination. It causes supination at the forearm. That is, when it is pulled, it is causing supination at the forearm. So what is the primary muscle for elbow flexion? It is your brachialis, which we will study. So biceps, short head from the coracoid process, long head from the supraglenoid tubercle. Okay, so this is about biceps. Biceps, I didn't go into depth because you all know the origin, insertion, and major function because, we flaunt our biceps. Next is brachialis. As I told you, it is a major important muscle for elbow flexion. It takes its origin from the distal half of the humerus. From here, it is a short muscle, or it will be only of this length. Okay, distal half of anterior surface of humerus and conoid process of ulna. It gets inserted into the ulna. So when it contracts, it will cause flexion. So you have to understand the location. It is present anteriorly. That's why it is causing flexion. If it is present posteriorly, it will cause what? It will cause extension. Okay. So this is the action of triceps. Brachialis. Brachialis. Next is brachioradialis. Brachioradialis takes its origin from the lateral supracondylar ridge of the humerus. That is, if this is the humerus, from this ridge, it is taking the origin, brachioradialis. From here, it gets inserted into the radial styloid process. That is, the styloid process is present here, right? Lower end. So it takes the origin from here and it gets inserted over here. So this whole part which is present on the lateral side. Guys, you can palpate your this part, this muscle which you can see the bulk here. It is your brachioradialis. Okay. So what is the action of the brachioradialis? As it is crossing the elbow joint anteriorly, I told you, you draw a line, you draw a joint line, and if any structure which is present anterior to that, it will cause your flexion. If any structure, any muscle which is present posterior to that joint line, it will cause extension. So as we have seen, it is present on the side and anteriorly. It will primarily cause forearm flexion when it is in semi-pronated position. From the semi-pronated position, if you want to flex, you are training your brachioradialis. If you want to train your brachialis, you have to do it in normal, your forearm should be in neutral position. If you want to train your which muscle? Brachioradialis, then you should semi-pronate. This is a semi-pronated position. From here, you have to do this movement. Then only your brachioradialis you are training. Okay, next triceps brachii. I have told you triceps, there are 3 heads. One is from the which tubercle? Infraglenoid tubercle, because 2, 3. Remember it this way. Okay, so infraglenoid tubercle, it has 3 heads. So longest head is from here because the distance from here to your olecranon process is longest from the infraglenoid tubercle. So from here, it travels posteriorly and it gets inserted on the olecranon process. Along with this was the big brother. Okay, so what big brothers do? Big brothers take their younger sisters with them. So this big brother is taking the 2 sisters, that is the medial sister and the lateral sister. So these 2 sisters are traveling. These 2 sisters joined their brother later. That is, this brother has come later. These 2 sisters have taken its origin from the shaft of the humerus on the posterior aspect, and they traveled along with their brother and they got inserted on the olecranon process. Olecranon process is below the elbow joint now. So it is also a 2 joint muscle which is causing extension of the elbow as well as extension of the shoulder joint. This is about the triceps brachii. And I have mentioned one more point, adduction of the arm, which is caused by long head. How is it possible? I've told you, you have to draw a joint line. Okay. As the triceps is closer to the joint line, when it contracts, it is pulling the humerus into adduction. So that's the reason why I have also added adduction, but it is not a primary adductor. You have to mention whether it is a primary adductor, primary abductor or not. Okay. It helps in adduction. You can write which head? Long head, because long head is the only head which crossed the shoulder joint. 2 sisters didn't cross the shoulder joint. Okay. Next. Question 6. There are 4 more questions left. Brachialis gets inserted into what? Brachialis, I wantedly didn't tell you the insertion of brachialis. So brachialis gets inserted into what? Your time is ticking, guys. A is tuberosity of ulna, B is tuberosity of radius, C is conoid process of ulna, conoid process of clavicle. Start. Answers. Brachialis gets inserted into what? Tuberosity of ulna, tuberosity of radius. Okay, guys who have answered tuberosity of ulna, you guys can tell me what gets inserted into tuberosity of radius. Start. Guys who have told by brachialis gets inserted into tuberosity of ulna, you also tell me what gets inserted into tuberosity of radius. Okay, I can see B, C also. B, C. Okay. Okay, nice. A, B, C. Oh, it's mixed. You are getting A, B, C, all. Brachialis gets inserted into ulna. Tuberosity of radius has what? It has the insertion of biceps brachii. Okay, so now next slide. We have a lot more slides. Let me finish it quickly. Okay, now we will start with flexor compartment. These muscles we will start. Then later we will study the extensor compartment. So flexor compartment, you have two parts, superficial part and deep part. Superficial are the muscles which are present when you cut the skin. You can see the muscles superficially. Okay, those are pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis. So pronator teres, we will start with pronator teres. Okay, so pronator, we will put a little logic here. Pronator origin, it has the origin from the medial epicondyle. So if it has the origin from the medial epicondyle, it has the origin from the medial epicondyle from here, it is getting inserted into the radius. So your pronator should have the origin on the ulna and it should get inserted on the radius. Why? Because when this muscle gets contracted, it will pull your forearm into pronation. As the name implies, pronator teres is your pronator. That is, it helps in pronation. Okay. So from here, it is pulling the forearm into pronation. Not whole forearm is getting pulled into pronation. Only your superior radio-ulnar joint is getting pulled into pronation. Next, what muscle is responsible for pronation of distal radio-ulnar joint? It is nothing but your pronator quadratus. So the pronator quadratus is the deeper muscle of the flexor compartment present beneath other muscles, other superficial muscles. And when this pronator quadratus contracts, it causes pronation. So the origin is from ulna to the radius. Do not write from the radius to the ulna, because if it is opposite, radius to the ulna, it will cause supination. So you have also studied now how supinator is originated. Supinator should be originated from the lateral side, lateral to medial. So when it contracts, it will cause your supination. Ulna to radius is pronation. Pronator teres, pronator quadratus. Radius to ulna is your supinator. Okay, so we have covered 3 muscles here. Hope I am making some sense. I hope this is useful. If this information is useful, I want you to give me a heads up, because this will boost up my confidence that you guys are understanding this. Please comment down if you are able to understand this. Okay, so pronator teres. Now, see, I don't know how you guys remembered this flexor carpi radialis ulnar, blah, 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 blah. Okay. How I remembered this was, see, each table here, this is for flexor carpi radialis, this is for palmaris longus, this is for flexor carpi ulnaris. So what you have to remember from the name, flexor, front compartment, carpi, it has insertion in the metacarpals, not the carpal bones. So none of the flexors have the origin from the carpal bones, except for flexor carpi ulnaris. Only this muscle has the insertion on these bones. Pisiform, this also I will teach you. Okay, starting with flexor carpi radialis. As we all know that all the flexors are originating from the medial epicondyle. Okay, it starts from the medial epicondyle flexors. From here, these muscles get originated. Okay, first comes your radialis. Why radialis? Because Okay. From here, it is getting started. Medial epicondyle. Okay. From here, it is coming this way. What muscle is this? Radialis, because this is the radial side. This is the ulnar side. Okay. If the muscle is traveling like this and if it is coming towards the radial side, that is your radialis. Flexor carpi radialis. Flexor carpi radialis, and it is getting inserted on the second and third metacarpal bones, not on thumb. Thumb has different. Again, do not get confused with the first metacarpal because this is different. We have pollicis everywhere if it is thumb. As it is radialis, write 2 and 3. Okay, here. Next is palmaris longus. Palmaris longus also takes origin from here. It travels the whole path and it gets inserted into the palmar aponeurosis of your hand. So do not write exact 2, 3, 4 metacarpal. You can directly write palmar aponeurosis because the name itself is telling you palmaris longus. Okay. Next is medial. Next is flexor carpi ulnaris. Ulnaris on the ulnar side. On the ulnar side. This is your ulnar side. This is the medial side. See. This is her right hand. Okay. This will become her ulnar side. This will become her radial side. That is lateral. Medially towards the body, it will become her ulnar side. So easily, blindly, you write flexor carpi ulnaris on the ulnar side. Flexor carpi radialis on the radial side. Extensor carpi ulnaris posteriorly on the ulnar side. Extensor carpi radialis posteriorly on the radial side. So you have studied all these muscles easily. Okay. So these muscles, as the name itself is suggesting, that flexor carpi radialis helps in wrist flexion and abduction. Abduction is this because it is present on the lateral side. No. So when this is contracting, it will cause abduction. Okay, wrist abduction. And when the ulnaris is contracting, it will cause wrist adduction. Adduction is nothing but adding to the body, right? So it will cause adduction or ulnar deviation. This is radial deviation. This is ulnar deviation. Palmaris longus, as it is present like this, it will cause flexion. Okay. Flexor digitorum superficialis, the most superficial muscle of your forearm. Flexor digitorum superficialis is the longest muscle after flexor digitorum profundus. So it also takes origin from the medial head. Okay, it fans out like this and it divides into 4 tendons. It divides into 4 tendons and it gets inserted into 2, 3, 4, and 5 5 middle phalanges. That is this, like this, it will get inserted. Okay. Okay. Like this on the middle phalanges on the sides, it will get inserted. Do not write first metacarpal if there is no pollicis in the name. Pollicis is nothing but the thumb. If there is pollicis, then you write that it is getting attached to the base of first metacarpal or proximal phalange of first metacarpal or distal phalange of first metacarpal if pollicis is there. If pollicis is not there, then you write it gets attached on the second metacarpal or third metacarpal, not carpals, metacarpals. Okay. It gets inserted onto the middle phalanx like this here. Okay. What happens when this contracts? When this is contracting, it will cause flexion of proximal interphalangeal joint. This is your proximal interphalangeal joint. This is your distal interphalangeal joint. So this is your proximal interphalangeal joint, this part. This is your distal interphalangeal joint. This is what? This is your metacarpophalangeal joint, this part. Okay. So when this is getting contracted, this, as it had its origin at the middle phalanx, it causes PIP flexion. What happens to flexor digitorum profundus? Flexor digitorum profundus is also a muscle like superficialis, but superficialis is the superficial muscle and beneath that you have flexor digitorum profundus. So this profundus muscle beneath the superficialis, it goes like this and it travels a further distance. That is, it goes and gets inserted into the distal phalanx. Both the sides, distal phalanx, it gets inserted. So now when this contracts, it will cause flexion of DIP. So now you tell me, Contraction of flexor digitorum superficialis causes what action? It causes PIP flexion. PIP flexion. PIP flexion. Contraction of flexor digitorum profundus causes FDP flexion. This moment which you can see here. Okay. So this is about flexor digitorum superficialis. Now, okay, guys, I'll wrap up soon. Now, deep muscles of flexor compartment. Pronator quadratus, I have covered that. It is present on the lower aspect, as you can see here. Okay, so the orientation should be from radius to ulna or ulna to radius. It should be from ulna to radius. Then only it can help in pronation. Okay. Its action is forearm pronation. We all know. See, flexor pollicis longus. Pollicis is nothing but it gets attached to the thumb. Now, draw a line. Okay, draw a joint line. If it is present anterior to thumb, anterior to this joint line, then it will become your flexor. If it is present on the side, if the muscle is present on the side like this, then it will become your abductor. Okay. If the muscle is present on the posterior aspect of this, it will become extensor pollicis. Okay. So flexor pollicis longus, it takes the origin from the anterior surface of the radius because it is on the radius side. This is the radial side, right? This is the radial side. This is the ulnar side. So on the radial side, it is taking the origin. So flexor pollicis longus, it takes the origin from the radius. It gets inserted into the distal phalanx of the thumb, this part of the thumb. So when this contracts, it will cause the flexion. So your flexion, extension, abduction, adduction are different for the thumb. So this is the adduction. This is the abduction of the thumb. This is the flexion. This is the extension of the thumb. So this muscle which is present over here, it will come like this anteriorly, and when it contracts, it will cause flexion. So flexor pollicis longus. Flexor digitorum profundus, I have taught you. These are the deep muscles. Now, time for the question. Flexor digitorum superficialis has its insertion at. Please comment down the answers. Flexor digitorum superficialis has its insertion at middle phalanges, proximal phalanges, distal phalanges, or metacarpals 2 to 5. I want the answers. Start. Middle phalange, proximal phalanges, distal phalanges. As you all know that flexor digitorum superficialis has 4 tendons. Okay. It has 4 tendons and it gets inserted into what? Just now I have told you. Very nice. It is middle phalanges 2 to 5. Now you tell me, FDP gets inserted where? FDP gets inserted in the distal phalanx. Okay. Lovely, guys. Lovely. Now coming to extensor compartment. This also I will finish soon. See, if you guys can take a screenshot of this, or if you can write down, because extensor carpi radialis longus, I have written 2, 3, 2 to 5, 5, 5, and here 1, 1, 1, 1, 2 I have written, right? So what is this? See, all the extensors take the origin from the extensor compartment and they travel backwards like this. Okay. Extensor carpi radialis longus. It is present on the radial side. What is longus? What is brevis? Extensor carpi radialis longus brevis. Longus means the muscle is long. Brevis means the muscle is short. So they are taking the origin from the ulna, from the posterior aspect of radius and ulna both. Radialis longus and brevis are taking the origin from the posterior aspect of radius. This is radius and ulna. They are getting inserted into the second metacarpal. So first longus is getting inserted into second metacarpal and brevis is getting inserted into the third metacarpal. That is this metacarpal. This metacarpal. Okay. Extensor digitorum. This is also a fan-shaped structure. See, anteriorly, we had 2 flexor digitorum. Okay. Anteriorly, we had 2 So these extensor compartment muscles, as you all know, that they are having origin on the lateral compartment. So these are the insertion points, 2, 3, 2, 5, 5, 5. These are the insertion points. And what is the action of that? Radialis longus brevis, it helps in extension as well as radial deviation. Extensor digitorum helps in extension of the fingers. Extensor carpi ulnaris, it helps in medial ulnar deviation along with flexor carpi ulnaris. Extensor digiti minimi helps in extension of the small finger. Okay. And supinator, see, I've told you pollicis. If the pollicis comes, it means it is helping the thumb in flexion, abduction, extension, as the name itself is telling you that extensor indicis is nothing but this. Okay. So it gets inserted in the extensor, a second metacarpal. So guys, I'm taking a small break here. Give me 2 minutes. I'll be back quickly. Guys, I'm back. Okay. Now, superficial muscle, deep muscles of extensor compartment done. Now, what are the intrinsic muscles of hand? Hope I'm making sense, guys. I don't want to bore you. That's why I'm wrapping it soon. Intrinsic muscles of hand are divided into thenar muscles and hypothenar muscles. Thenar muscles are these muscles. Hypothenar muscles are these muscles which has the insertion on the digiti minimi, or I can say the little finger. Thenar has the origin and insertion over here. That is your thumb or pollicis. So whatever pollicis not longus. Longus is a long muscle which has the origin from somewhere else. It is brevis. That is, it is a short muscle. So flexor pollicis brevis, abductor pollicis brevis, opponens pollicis brevis. These muscles are the thenar muscles, and these muscles are the hypothenar muscles, which are abductor digiti minimi, flexor digiti minimi, and opponens digiti minimi. Okay. Time for quiz. Which among the following is not a thenar muscle? Which among the following is not a thenar muscle? Read the question properly. Which among the following is not a thenar muscle? Flexor pollicis longus, flexor pollicis brevis, abductor pollicis brevis, opponens pollicis. I have given you all pollicis here. So what you have to pick from this is important. Which muscle is not a thenar muscle? Guys, you have a prize at the end. I want you to comment down. Which among the following is not a thenar muscle? A, B, C, or D? A, B, C, or D? D? See, D. Do you think D is not a thenar muscle? Which muscle is not a thenar muscle? Yes. Flexor pollicis longus is not a thenar muscle. Why? Because it is a flexor pollicis longus which is coming from somewhere else. So these are the thenar muscles. I will not go deep into the thenar muscles because it will take a longer time for me to explain you all this. Flexor pollicis brevis, abductor pollicis brevis, opponens pollicis brevis. These muscles have the action as the name itself is telling you. Hypothenar muscles, flexor digiti minimi, abductor digiti minimi, opponens digiti minimi. Next question, guys. Lumbricals take their origin from which structure? Next slide is about the lumbricals. Which lumbricals take its origin from which structure? A, B, C, D. Tendons of extensor digitorum, tendons of FDS, tendons of FDP, extensor expansion. Guys, we are noting down the names of the contestants or the participants who are continuously giving us the correct answer. You have some good announcement in the last. We have winners and we have some prizes for you. Lumbricals take their origin from which structure? A, tendons of extensor digitorum. I thought lumbricals are present on the anterior aspect. From anterior aspect, okay, I will tell you one very interesting fact about it. You will love it. Okay, first let me see your answers. So, okay, majority of you have typed C, that is tendons of FDP. Correct. It takes the origin from the flexor digitorum profundus. Okay, lumbricals take the origin from the flexor digitorum profundus, and you draw a joint line here. Okay, when you're drawing the joint line here, anterior to metacarpophalangeal joint, it is present anteriorly, lumbricals. And as it goes up, it will cross this like this, and it will go and attach to the extensor expansion. Now it became a flexor as well as extensor, right? So lumbricals has a dual action. How? For MCP, it will cause flexion because it is present anterior. For interphalanges, it will cause extension. It will cause extension because it crossed the midline and it went backwards posteriorly. Hence, it will become an extensor of interphalangeal joint. So, when you see it from the side view, it is like this. So, it is this action. That is flexion of MCP and extension of IP. So, if someone asks you what is the action of lumbricals, you show them this. This is the action of lumbricals. That is nothing but metacarpophalangeal flexion and extension of IP joints. So, this is the action of lumbricals, guys. Okay. Interesting muscles of hand are divided into lumbricals and interosseous. Lumbricals we have studied. It takes the origin from the flexor digitorum profundus. See, okay, like this. It gets inserted into the extensor expansion of hand. From anteriorly, it is going posterior. Okay, so it has dual action, 2 to 5 finger flexion as well as extension. Question number 10. Last question, guys. Last question. What is the function of palmar interossei? So we know that there are two interossei. One is palmar interossei, one is dorsal interossei. Palmar interossei are nothing but the interossei which is present on the anterior aspect, dorsal interossei on the dorsal aspect. So they take their origin from the bones, metacarpal bones. Okay, I will show you an image. In that image, you will understand everything. First, answer this question. What is the function of palmar interossei? This is the last question of our webinar. This is the last question of our webinar. What is the function of palmar interossei? Finger adduction, finger abduction, finger extension, none of the above. A, B, C, D. I don't know how you guys remember this. The correct answer is A, finger adduction. How did I remember is, when you want to drink water, you tend to do this. Okay, this is nothing but adduction. So you are adducting and you are then drinking the water. So this is caused by palmar because you are seeing the palmar surface. Okay. Dorsal interossei, girls, when you see your nail polish, you see it like this, right? In this way. So this is nothing but your abduction. So abduction is done by dorsal interossei. So I have studied it this way, that this is palmar interossei, this is dorsal interossei. Okay. So its origin and insertion is like this. See, the dorsal interossei, it has the origin like this. Okay. It is like this. So when they contract, it will pull all the fingers apart like this. Hence, it helps in abduction. And see the orientation of muscles of palmar interossei. They are present outwards like this. So when they contract, it will pull it like this. That is, it will pull the muscles into adduction. It will pull the joints into adduction. So palmar interossei has this and dorsal interossei function is abduction. So guys, this was about today's webinar, that is anatomy of muscles, which I hope I made some sense by teaching you some new techniques to how to remember a muscle. Because if I suddenly ask you what is the action of middle trapezius or what is the action of serratus anterior, you guys will not tend to remember it. So now, as I have shown it on the model and as we have studied it in this way, I hope you guys will understand and you will remember it for the rest of your lives. I'm sorry I couldn't get much time to explain you other flexor and extensor compartment muscles. It is nothing. You can easily remember that flexors take the origin from the medial epicondyle, extensors take the origin from the lateral epicondyle. Okay. So this was about the webinar. Just wait for the announcement of the winners. So Amir, you can take from here.
Good evening, everybody. A warm evening to one and all students. So I could see a lot of students participating very well in the quiz, and also I'm extremely happy to have you guys here. So we at Prakara Learning are also supporting students in their curriculum basically. So firstly, we have launched our BPT mini learning program, which is for first years, which is for just rupees 399, wherein you would be getting the video lectures by our subject matter experts. You would be getting student notes for your reference and your revision. You would be getting key terms for your terminological understanding, as well as you would be getting MCQs for your self assessment. Apart from this, this is according to your syllabi, which would be making you easy to learn as well as to give you a basic scope in terms of learning visually. Because I can see most of 70% of the concepts of physiotherapy need this visual feast. So with that idea, we have launched this mini learning program. Whoever have exactly joined this webinar are in first year can avail this opportunity. Fine by calling to our below numbers, which is 741 6600 658, or can download Prakara learning application and can select the first year curriculum and get this off. And we understand that the curriculum plays a very important for first, second, third, and fourth years respectively. As of we are providing Bachelor's of Physiotherapy content, which is first year, including live webinar sessions on the prime topics, as well as doubt solving sessions by our subject matter experts every bi-weekly. In this, you get video lectures by the subject matter experts, you get key terms for your terminological understanding, you get student notes for your revision and your reference purpose, and most importantly, you get MCQs and quizzes for your self-assessment. As I can show you, it is rupees 2499, and whoever has joined this webinar would be getting a 20% off on all the courses except the mini learning program. And for second, third, and fourth years, we have introduced the exam module with which they can score well in their examinations, and we know and we understand how much hard the students work, and we also want them to be encouraged in terms of making their confidence boost. So that is the reason we have launched a exam module for first year, second year, third, and fourth years respectively. And whoever has joined this webinar today would be getting a 15% discount on each and every course except MLP. You can use our platform to learn, to explore, and to experience the best of physiotherapy in your curriculum. And if there are any seminars carrying forward, we would also be posting that on our WhatsApp group, which is exclusive for the physiotherapy. Fine. I wish all the best to all the students who have exactly joined the webinar, and I appreciate their admiration towards learning, towards making this session a eye feast as well as a flying color thing. Thank you so much. Yeah, the most awaited event of today's evening is declaring the winners who have participated very well. I can see close to 50 to 60 students participating very aggressively, with which we were extremely happy to see all the responses coming by. So we would be announcing the winners by today end of the day. So kindly join our WhatsApp group where we would be posting the winners by tomorrow morning at 11:30 sharp. We would be posting the name of the winners of this quiz competition tomorrow at 11:30 sharp on our all social handles, including the Instagram pages and the WhatsApp group. I would request everybody to stay tuned to our WhatsApp and Instagram handles such that you guys would be knowing the updates, and whoever is whoever is on the top 1, 2, and 3 would be getting exciting prizes from Prakara Learning. And over to Manisha.
Hi guys, I'm back, but Preeti is gone. So Arjun Reddy is all alone here. So guys, um, uh, There will be a part 2 if you guys are interested in part 2, in which I will be talking about the lower limb muscles, your hip muscles, your knee muscles, your sole of the foot, which is the very complicated one. So if you guys want to join that, or if you guys are interested, if I get more number of registrations, I would like to take a part 2 on the lower limbs. So please comment down if you need a part 2, and also you can message us personally on our WhatsApp number. Okay, hope to see you soon in part 2 if you guys are interested. Over to you, Amar. We can end the session now.
Yeah. Thank you so much, everybody. And all the certificates which are exactly present would be sent to your respective emails as you have already registered on our page, on our form. Fine. So we would be sending you to the respective email IDs. Whoever have not filled the form, we are posting the form in our chat box. Kindly fill the form now such that we could send you the certificates. Thank you so much. Have a great evening and have a great weekend, students.